हे गूगल, मेरे सर में दर्द हो रहा है। कैंसर है तुमको। मेरी टांग में भी दर्द हो रहा है। गई, कटेंगी ये तो। कैंसर। मेरी कमर में दर्द है। ओह, ये तो कमर का कैंसर है।
There was a time when cancer was extremely rare, especially in India. But this is not the case now. Every year, more than 10 lakh people in India are getting diagnosed with cancer, and this number is expected to increase in the coming years. But why are cancer cases rising? What is that we can do to keep ourselves immune from it? And most importantly, what are the early signs which may point at the possibility of a growing tumor in our body? See, there is no doubt that cancer is a serious disease. But what's good is that if cancer is caught in the beginning stages, it can be easily treated. Doctors are unanimous on this, and they often say that when it comes to cancer, early detection is the hallmark to cure. Which is why in this video, I want to put forth 6 signs that might indicate that there is some cancerous tumor growing in the body. I understand that cancer is not something which can be randomly talked about, which is why for this video, I have got in touch with various cancer treating doctors so that I can responsibly share only that information which is authentic and helpful. The idea behind making this video is not to scare you, but to inform you so that you can stay vigilant and catch hold of any anomaly, if any, in your body. As we will discuss the signs, we'll try to make this more clear. Towards the end of the video, we will also discuss what simple yet effective things we can do on a daily basis to keep ourselves safe from it. So without any further delay, with a positive mindset, let's get started. Hello friends, welcome to FitTuber. The very first sign that may indicate the presence of cancer is when there is thickening of a tissue or a lump. When people think of cancer, they often think of a lump formation in the body. While it is true that a lump is an obvious feature of a possible cancer, but I want to stress that most lumps are not cancer. There are many reasons because of which a small lump, cyst, etc. can be formed in the body. But in rare cases, it can be a possible indication of cancer. Typically, cancer lumps feel hard to touch. They are hard to move between fingers and thumb. Secondly, if you see a lump formed in the body and it pains when you touch it, then most likely it's not a cancer but an underlying infection. Because it's a common saying among doctors that a painless lump is a cancerous lump. Still, this is doctor's job to decide. Our job is to seek medical attention and be sure of what it is. Most common places where swollen lumps are formed are under the armpits, near the neck area, near groin area, and on top of the legs. Lump formations are common with breast and testicular cancers. Testicular cancer is common in young age, in 20s and 30s, while as you grow old, the chances of testicular cancer decreases. In testicular cancer, the very first sign that shows up is that one testis becomes heavier than the other one. If you notice that one testis is descending more than the other, it is abnormal and medical attention is advised. Next sign is unexplained weight loss. According to the American Cancer Society, unexplained weight loss is often the first noticeable symptom of cancers of the esophagus, pancreas, stomach, and lungs. Let's say someone has not reduced his food intake. He has done nothing to reduce weight and still his weight reduces quick and unexpectedly. This is something that needs attention. Doctors say that if you lose more than 5% of your body weight in a period of 6 months without even trying to, then better get yourself diagnosed. However, this symptom is also very common in diabetes, thyroid malfunction, and tuberculosis, but in rare scenario, it can also be an early sign of some cancer growing in the body. The third sign that may indicate cancer is unexplained bleeding. Any unexplained bleeding, for instance, nose bleeding.
What? Nose bleeding? It's so common. How can this be a sign of cancer?
Yes, you are right. Nose bleeding is common among people who have this habit of picking their noses. That's normal. But if nose bleeding is persistent and unexplained, that is, you have no idea why your nose is bleeding, then in an odd case, it can be a very early sign of colon cancer. Another example of unexplained bleeding is when you sight blood in urine. Because blood in urine is never considered normal. The only scenario where there can be blood in urine is during a woman's period, but that's coming from the vagina and not urethra. Then if if someone vomits and there is blood in it, this is also not normal. Someone spits and there is blood in it, if gums are bleeding, that's of course not serious, but otherwise blood in sputum is abnormal. In fact, this is seen as an early sign in tuberculosis and lung cancer. Then there can be blood in stool. Certainly if someone has piles, then there can be blood in stool, but sometimes stool which is dark and tarry, this can also be due to bleeding in the upper part of the gut. For example, there is bleeding in the food pipe. The person eats food and the blood gets mixed in it. Post digestion, when the waste is evacuated, that stool will be dark and tarry. This occult bleeding can also be seen in the case of vomiting, where blood is found in grounded coffee color. This indicates an internal bleeding in the stomach area. If this thing, blood in vomit, dark stools, persist for days, then undoubtedly there is something wrong within. Now in most cases it will not be cancer, but better get it checked. Fourth sign is persistent cough. Generally when we get cough, it stays for a week or two and then subsides. But in case your cough is not going away even after 2-3 months, then this is a sign you need to be alert about. Most of the times it will be some lung congestion, but in some odd time it can be cancerous as well. Especially when you also experience change in voice. Generally when voice gets a bit rough, hoarse, this in rare scenario can be a sign of thyroid cancer. Fifth sign, which is also a classic sign of cancerous growth, it is when there is a new mole formed in the body or there are sudden changes to an existing mole or what. If you see a mole on your body where you didn't have a mole before, or if you see changes in the appearance of an existing mole, this is something that needs attention. Doctors give a very useful ABCDE formula to identify changes in an existing mole. A stands for asymmetry. Ask yourself, has the mole become asymmetric on both sides? B stands for border. Are the borders becoming irregular? C for color. Has the color of the mole changed? Generally in the case of cancer, an existing mole gets darker in color. D for diameter. Has the diameter of the mole increased? E is for elevation. Has the mole become higher than before? These are the things that can clearly be noticed regarding an existing mole. Normally, a dermatologist can recognize these by sight if they are cancerous or not. If they are unable to tell, then biopsy can very definitively confirm it. Sixth sign is when you experience significant changes in your bowel and bladder habits. Urine and stool can give certain clues about something that's going wrong within the body. Talking about urine first, if the frequency of your urine has unexpectedly increased, means you are not drinking enough water or something, but still you feel the desire to pee after every few hours, this is a sign. And then when you go to pee, you seem to face difficulty in initiating the urine. After urinating also, you don't feel satisfied. Plus there is no full streak of urine, you are just dribbling a bit. These are all lower urinary tract symptoms and can be due to kidney malfunction also. So there is no need to panic. In rare cases, these are due to prostate cancer. So it's best to get diagnosed. Regarding bowel habits, we have already discussed a bit before that dark tarry stools point at internal bleeding somewhere in the system. Similarly, if someone experiences pale stools continuously for no good reason, this in most cases is liver problem, but it is better diagnosed than assumed. In a nutshell, anything that you feel is quite abnormal related to stool or urine, and this you are noticing for days and weeks, better get it checked. Apart from these 6 signs, if your fever is not going away for months at a stretch, or there is some wound that is not healing, or there is unexplained pain in the body which is not subsiding, then all these abnormalities point at one thing, that your body is not healing itself. This in rare case can be an early sign of cancer cells developing in the body. Why are cancer cases getting so common nowadays? What is that we can do to prevent cancer? Which are the top cancer causing foods? We will discuss the solution part, but before that I want to share with you that thing that every one of us should eat daily no matter what. It's desi cow ghee. Anveshan A2 cow ghee is one such genuine desi ghee option in the Indian market. No doubt this is a sponsored product, but had I been making a video on best ghee in India, this would have been placed in the best category. That's because it's made using the traditional Bellona method. Basically, milk is turned into curd and then curd is churned to get butter, and the butter is heated to get pure golden nectar called ghee. According to Ayurveda, this ghee is the best source of healthy fats. It is this ghee which reduces bad cholesterol cholesterol and normalizes blood pressure. It is this ghee which is super rich in CLA, which shrinks the stubborn fat cells. It is this ghee which lubricates the joints. It is this ghee whose 1 or 2 spoons you should top over the curries. Anveshan ghee comes in 2 variants, Gir cow ghee and Halikar cow ghee. Both are renowned desi cow breeds. Anveshan ghee also comes in this great looking 5-liter stainless steel dolchi. This is an economical option as ghee doesn't go bad with time. In fact, 10 years aged ghee is healthier than fresh ghee. Buying this dolchi, you not only save money but also you get to eat more healthy ghee. Not to forget that this good quality and useful dolchi is free along. Anveshan is further providing a 15% discount especially for the FitTuber community. So don't wait and grab one dolchi for your family. Coming back to cancer, why is it increasing? What can we do to stay immune from it? After getting in touch with various cancer specialists, I have understood that a poor lifestyle puts us at risk of getting cancer. Cancer was never common in India. Rather, cancer has always been quite common in America. Studies point out that American diet is high in processed foods and low in fresh fruits and vegetables, which contributes to high cancer risk. Since multinational food joints like McDonald's etc. have become a commonality in India, we are paying the price. Doctors agree that Ajinomoto-based Chinese food, processed junk foods, and an overall switch from homely diet to outside street foods is one major reason of growing cancer in India. Certain everyday foods are strongly linked to higher cancer risk. Top among them are processed meats like sausages and salami, which contain carcinogenic compounds formed during curing and smoking. Then fried foods like chips and French fries can form acrylamide, a probable human carcinogen. Overcooked meats, especially when grilled or barbecued, release dangerous chemicals like PAHs and HCAs. Sugary foods and refined carbs increase the risk by promoting obesity and inflammation in the body. Alcohol breaks down into acetaldehyde, a common carcinogen that damages DNA. Then stress is also a very major cause of cancer. Not the mundane stress, but some event that creates persistent feeling of tension in the body. For example, loss of someone, separation with a loved one. Doctors agreed that these things over a period of time can lead to cancer development. Then if you have a family history of cancers, then you are definitely more at risk. But one thing that doctors unitedly say is that if a person takes care of his health, which means that if he avoids junk, eats homely, eats at relatively fixed timings, keeps himself active, sleeps on time, sleeps well, he is most likely to never develop cancer. In fact, someone who practices intermittent fasting daily, healing triggers in the body which kills cancer cells if any. Then 15 minutes of daily yogic pranayama can greatly help you in preventing cancer and other common diseases of the body. In fact, I once got a chance to meet a lady who had reversed her 4th stage cancer without chemotherapy by just doing Kapalbhati and Anulom Vilom daily for 6 hours. So there is no need to panic provided we stick down to the basics. Don't forget to check out Anveshan ghee in the description box below, and for a full day diet plan video to lose body fat in a healthy manner, click here. My name is Vivek. I thank you so much for watching.